Atrial fibrillation, or AFib, is the most common heart rhythm disorder, and it can be far more dangerous than people think. It's not just an irregular heartbeat, it's a chaotic electrical problem inside the heart that dramatically increases the risk of stroke. Normally, the heart beats in a coordinated rhythm. Electrical signals start in the sinoatrial node, spread across the atria, then move to the ventricles to produce a smooth, organized heartbeat. In atrial fibrillation, those electrical signals become disorganized and rapid. Instead of contracting normally, the atria quiver. They fibrillate. When the atria lose their ability to squeeze properly, blood doesn't move smoothly. It starts to pool, especially in an area called the left atrial appendage, a small pouch where blood is more likely to sit. And when blood sits still, it forms clots. This is where the stroke risk comes in. If a clot forms in the left atrium, it can break off and travel through the bloodstream. Once it reaches the brain, it blocks an artery and causes ischemic shock. That's why people with untreated AFib are 5 times more likely to have stroke. On the surface, AFib can feel like palpitations, a racing heartbeat, shortness of breath, or dizziness. Some people feel nothing at all, which makes it even more dangerous. AFib can be intermediate, coming and going, or constant. Either way, the risk of clot formation is always there. AFib can develop from multiple causes: high blood pressure, sleep apnea, heart valve disease, hyperthyroidism, or chronic alcohol use. Age is a major factor as well. Over time, the atria stretch, scar, and become electrically unstable, which makes the rhythm easier to trigger and harder to stop. Treatment focuses on 2 goals: controlling the heart rhythm, or rate, and preventing stroke. Medications may slow the heart down or try to restore normal rhythm. Procedures like cardioversion or albation can help reset or isolate normal and abnormal electrical pathways. But most importantly, many patients need blood thinners to prevent clots from forming in the first place. Arterial fibrillation isn't always dramatic, but its consequences can be. The rhythm may be chaotic, but the danger comes from what happens next. When a clot formed in the heart suddenly blocks blood flow to the brain. Understanding AFib is the first step to preventing the stroke it can cause.